Hello, my name is Chelsea Frost. I'm from the University of South Florida Morsani College of Medicine in Tampa, Florida. I am a third-year medical student. So today I will be discussing the online reviews of orthopedic surgeons and the emerging trend. I have no financial disclosures. So when we began this project, we had three objectives. The first was to analyze the differences in patient ratings and reviews of physicians based on various factors. These factors included gender, practice sector, specifically academic versus private, number of years in practice since their fellowship is ended, geographical location, and membership in a minority organization, specifically the J. Robert Gladden Society. The second was to understand the impact patient online reviews and ratings can hold, and the last was to apply this knowledge to better improve interactions with patients. There have been many articles analyzing the prevalence of ratings on physician review websites for other specialties, but none such were found for orthopedics. So a physician review website, or a PRW, can be thought of as a marketing survey. It provides insight into patient perceptions of medical care and allows the assessment of factors important to consumers. It also enables patients to remain anonymous as they provide these reviews. Many private and governmental agencies have begun to set up their own forms of PRWs in order to compare healthcare entities. In the United Kingdom, the National Health Service instituted the NHS Choices website, which allows patients to evaluate physicians and hospitals. In the U.S., the Center for Medicare and Medicaid Services instituted the Physician Compare website, which shows data about Medicare accepting physicians from the voluntary physician quality rating systems. However, patients are unable to individually rate physicians at this time. So when we were conducting this research, we were looking at 600 surgeons from the 30 most populated U.S. cities based on the 2012 U.S. Census Bureau. We were using a public database and selecting the first 20 surgeons for each of these 30 cities and collecting the data based on the various factors I mentioned earlier. As we were collecting this data, we realized that some of the physicians we had selected were residents, fellows, or retirees and were thus excluded. So after exclusions, we were looking at 557 surgeons. For each of them, we collected the numerical ratings from 7 PRWs and standardized their ratings on a 0 to 100 scale. We also were collecting written reviews and categorizing those as positive or negative, and student t-tests and ANOVAs were performed for each of the factors analyzed. Of the 557 surgeons we were looking at, 525 were rated on at least one PRW, and the average rating was a 71.4%. with 76% of orthopedists having positive ratings with a score of 60 or greater. As we were analyzing the results, we realized that there was no statistically significant difference based on gender or geographic location. However, there were statistically higher ratings for those in the academic sector versus the private sector. We believe this is because those in the academic sector have residents and sometimes medical students who will see the patients, and so the patients may perceive this as having a shorter wait time and thus lead to positive reviews. While there were statistically higher ratings for those in the J. Robert Gladden Society versus non-members, and we believe this is also because many of those members are in the academic sector. As we were comparing based on the number of years in practice since their fellowship ended, we realized that those in the 6 to 10 year group had the highest ratings, and they were statistically higher ratings than those in the 0 to 5 year group, as well as the 21 plus year group. We believe this is because those in the 6 to 10 year group have embraced PRWs and have the patient volume to direct satisfied patients to complete these reviews on the websites, while those in the 0 to 5 year group are still trying to establish their practice and establish their patient volume. Those in the 21 plus year group may have little motivation to embrace the PRWs, as they may already have the maximum desired patient volume. In terms of the written reviews, we were collecting the data from vitals.com. We chose vitals.com as it had the largest percent of rated physicians with written comments. We randomly selected 20% of our original 557 sample size, and the most recently written comment was collected and categorized as extremely positive, positive, neutral, negative, or extremely negative. those deemed extremely positive or extremely negative were either overly flattering or rude and essentially unconstructive. Those deemed positive or negative, however, were supported by an explanation. 86% of our randomly selected group had written reviews on vitals.com, with about 65% as being either positive or extremely positive. So what does all of this information mean? Well, 47% of patients have searched about their provider online. 37% have consulted a PRW prior to seeking care, and 30% have compared ratings of physicians online before even selecting a physician. So as you can tell, patients are increasingly using PRWs, and physicians should therefore consider monitoring their ratings and modifying practice factors contributing to negative ratings or reviews. Patient satisfaction, quality of care, and outcomes are important components of quality assessments of physicians and their practices. And most PRWs will have a breakdown of factors that patients will individually rate. Relatively few patients will submit a rating or a review, and so negative responses can greatly impact a score. And physicians should therefore consider encouraging satisfied patients to go and submit ratings or reviews in order to potentially dilute any inaccurate reviews. PRWs can therefore serve as useful quantitative tools to study practice factors that can influence patient ratings. Now, before I conclude, I'd like to discuss the limitations of this study. The first was that we only use the free and publicly accessible PRWs for our data. We excluded those popular websites that require paid subscriptions, such as angieslist.com. We also collected the written reviews data solely from vitals.com. However, we deemed this appropriate as it had the highest percentage of written reviews for our sample. And we also assumed authenticity of all submitted ratings and written reviews. It should be noted that anyone with an email address can leave a review, including competing offices. However, many states are making this illegal, and companies can be fined for false advertising. So in conclusion, I'd just like to thank Dr. Adisu Mesfin from the University of Rochester School of Medicine for serving as my mentor. Are there any questions?